Good morning, guys. Welcome to Pioneer Advanced Hair Transplant Center. And get you all authenticated information on hair transplant results. Today we have one more repair transplant surgery results. I would like to bring to your notice. Kindly remember when we talk about repair transplant surgeries, most of the cases it doesn't make any sense if you just talk about the repair transplant. We are here to repair it with the results and trying to bring to your notice or uploading the videos. That makes a lot of effort for us to do that work, and even uploading the videos also. Kindly watch this video until end to understand the sad story of this patient. Thank you. This patient approached me with the kind of a botched transplant results. This man had a transplant 1.5 years back, I guess. And I'm again kind of reminding you guys this, not only showing the botched transplant, we are showing you the results after repair. That's the nightmare for a surgeon. And it's not a joke to repair the transplant and keep the videos here every day, because that will take more than 8-9 months to record the video, and we have to get the results to show it. That's very important aspect here. This patient unfortunately ended up in getting a transplant done with a kind of substandard clinic with kind of amateur doctors or technicians, I don't remember. When he walked into my office, I could see this transplant is not the kind of a failure, it is a kind of disaster, I can say. So a failure transplant is different, disastrous transplant is different. A failure transplant is kind of you do the transplant with good effort, still you don't get good results. That's common in most of the clinics. I can't deny the fact, because out of 1,000 cases, definitely 10-20 surgeries will go failure. When come to the disastrous hair transplant, it's a kind of someone who doesn't know ABCD of doing a transplant surgery and still they're doing transplants, would lead to that kind of disastrous hair transplant results. In this patient, what went wrong is, number one is someone doesn't know even how to design the hairline and go to make the hairline design and where exactly they need to implant the graft. There is no proper idea. I just did transplant, send them, and that transplant done well. After 1.5 years, it turns out to be kind of a disastrous outcome. Here, disastrous means neither there is a good hairline, nor density, nor backside donor. If you can observe this patient, completely ruined transplant, I can say, because backside there is a kind of a botched harvestation. They have done it. It's kind of a patchy harvestation, moth-eaten appearance. That means someone doesn't know minimum basics how to harvest the grafts. If you can see a patch of backside donor has been harvested, I don't know how does it make sense, because when you really want to harvest some grafts, it's better to uniformly harvest it and leave the balanced donor remain backside. That's the important concept of the harvesting the grafts. This patient ended in a kind of a very bad transplant with kind of amateur clinics or budget transplants, I don't know. Frontal hairline is completely gone bad, and its density is really bad, and donor aspect, if you can observe it, totally gone wrong. This kind of a hair transplant gone for a toss. So a probable reason would be kind of maybe budget transplant according to the patient inputs and feedback. I got it. When he walked into my office, I had in my mind how to balance this donor, because there's a patch already taken out in the mid scalp, in the occipital area. I left with only sides, parietal areas, a few grafts. The massive erratic harvestment has been done. Who has done it? Kindly, they don't even know basics of harvesting techniques, and rather harvesting, they damaged a lot. So that's the thing happened to him, and a lot of fibrosis in that area. You can see the skin discoloration also. That's the kind of the substandard transplant, and one should kindly beware of that kind of transplant and clinics. That will definitely difficult for lead to difficult for second time transplant also. We had a kind of a super smart session to avoid harvesting that area and balance the other areas, which still preserved the best donor. And in the frontal hairline, if you see that has to be removed few aspects, especially in the frontal hairline as well as the temporal angle. We need to remove few grafts also. Well, surgery went very well. We removed few grafts in the frontal area, and even in the corners we removed it. In this patient we recreated the new hairline as well as the implanted few grafts in the temple area. And well, one utmost care has been taken in the donor harvesting time. We did not, we spared that backside which is already damaged. We did not harvest the grafts there because they already done very badly harvested in the back. That area we cannot harvest anymore. So we need to balance it in the backside such a way that you would end up in having a super balanced donor area in the backside. So we achieved excellent results after 10 months, and very happy to see him. And of course, kindly remember this patient also may need second session to get a little more density, but as of now, he is much satisfied with the results, and we are very happy to see that kind of outcome. We same time we could remove the grafts in the frontal area as well as we could implant the good grafts in the frontal area, and with the balancing the damaged donor also. All aspects went very well, and we achieved fantastic results. This is one session of repair transplant. This man had horrible hairline done different place. If you can see, now we removed a lot of the places, the frontal grafts, even in the sides also. While doing second session, we had nightmare to harvest the graft, but however, still we maintained the donor. See the difference of the donor. It looks almost same. It looks almost same. That's the donor management scenario. While once when we plan the transplantation, donor maintenance and donor management is the most utmost care has to be taken. Otherwise, donor will be damaged. If you can see this donor, it still maintains very well and far better than before. That's the beauty of the best transplantation clinics. So balanced donor we say, or managed donor management we say. So that's the thing. I can still get few more hairs for him next session also. That's the most important aspect one has to understand before you guys choose the best clinics for transplantation. And that's the quality of the transplant one should look for. Otherwise, you end up in kind of a botched transplant and spending multiple times for it. Kindly remember choosing for the best doctors to get it on your transplant. That's almost utmost important point to be discussed while talking about hair transplantation results. Most of the cases, why this would happen, if you ask me, we already discussed about the failure transplant and disastrous transplant. Kindly remember the difference between a failure transplant and the disastrous transplant. A failure transplant can happen any surgeon's hand. Of course, that's I don't deny the fact that any surgeon can get you a failure transplant results for you. But well, during the consultation, we can have a clear discussion whether this guy is going to get good results or not. That chances are very less if you can choose a best patient. Well, what is a disastrous transplant? A disastrous transplant is just when they do the transplantation of any case, good case, even still they get a botched outcome and kind of a disastrous, horrible outcome. That means they cannot get results in any kind of patients. That's the kind of transplant called as a disastrous outcome. Someone has done who doesn't know kind of techniques and even basic protocols of surgery. They will perform the surgery to kind of results you achieve is definitely horrible. That is called the disastrous transplantation. So these are the two differences. Why this will happen is because probably he ended up in choosing a budget transplant, or and he did not have a discussion with his surgeon who is going to operate on him. These are the two reasons. Probably, I'm guessing that's the reasons he got this kind of ended up in this kind of results. So kindly take care of yourself about when you're talking about your surgeon, and kindly take discussions about your surgery as well as your pros and cons, and what are the results you're going to expect, what are the design you want to getting details from your surgeon. All this definitely makes sense when you're in a consultation. So give it a try to talk to your surgeon before going to do a surgery. Then you end up in good results. That's what my opinion. Thanks for watching our videos. Thank you.